At Quantum Vitality, we have developed a system for scheduling patient appointments that hopefully is flexible enough, makes it easy for everybody to choose how they want to handle their care. In the beginning of treatment, we usually will schedule a block of treatments until we get to the first re-exam. And at the first re-exam, once we determine if any additional care is needed, we will recommend scheduling a block to the next re-exam. And we do that so that we have objective targets. We know we have an end point in sight for each increment of care, and our decisions are made based on objective information. Pain scale, functional questionnaires, algometry measurements, postural measurements. We use as much information as possible to determine what's the appropriate method. And once we determine how we're going to approach this, you as the patient get the flexibility of deciding what's best for you. Now, we recommend in the beginning to work aggressively. We like to minimize the slippage that occurs in between visits. You come in for a treatment, you make a little improvement, and you immediately start slipping back to where you started. If we get the second treatment close together, we catch it before it slips. So it's kind of like you take 2 steps forward and 1 step back. 2 steps forward, 1 step back. And if we work the treatment plan fairly tight, we minimize that slippage backwards. Now, we also like to make the scheduling as convenient as possible for you, the patient. Now, we have evening, we have weekend hours. If you are the type of person that likes to schedule your life, we love when you schedule in advance. It's good for everybody. Some people just can't book in advance. Now, so a lot of people can book all their appointments and they keep their appointments and they're punctual. In our office, the people that made appointments and are on time, they are taken first through our therapy. People who made an appointment but get here a little bit late or they get here a little early, we will work them in next. So there may just be a very minimal wait, but usually very efficient. Now, there's also some patients who just cannot schedule. They're on the road all the time, or they have too many things going on. For whatever reason, they can't commit to a fixed schedule. Now, we're happy to work with people on that basis. You can designate yourself as a walk-in. Not a problem. Walk-ins can come in, and if we don't have other people waiting, there will be no wait. But we do take the people first who had appointments and were on time. Second, people who had appointments are a little early or a little late. And lastly, we take people who are walk-ins. So although it may seem like we're making it really easy for you to make your choice, we really want you to do what's best for you. I'd like you to be able to set up your schedule. We'd like you to feel comfortable with how you're handling your schedule. You get to choose which method is best for you to fit your schedule and minimize waiting. Whatever works best for you, we're happy to do. So our staff will be glad to go over all of this with you and help you schedule what you prefer.